Hi, I'm Dr. Henry Black from the New York University School of Medicine and President of the American Society of Hypertension. Today I'd like to talk to you about the SEAS trial, which was the simvastatin and ezetimibe study of aortic stenosis. What this trial was designed to do was to see if that combination, which is Vytorin, would prevent the development of new aortic stenosis or surgery related to aortic stenosis in patients who got that combination as opposed to placebo. I want to talk to you about several aspects of it, not just what the results were, but what we have to contend with right now. Now, SEAS was a trial of about 1,870 people who didn't have evidence of cardiovascular disease or indications for statin therapy or LDL lowering therapy, but who had mild to moderate aortic stenosis. Aortic stenosis in older people is a major problem, and there was some reason to think that lowering LDL would be beneficial. Now, what the study showed was no particular benefit for aortic stenosis or for the overall endpoint, which included aortic stenosis plus cardiovascular disease, but it did show, really for the first time, that that combination, which lowered LDL about 60%, did prevent some cardiovascular events. Now, I can't give you at this moment the real results of that study because all I have is a press release and a further analysis done by the Oxford group about one of the problems with the study. I really wish we wouldn't see things as press releases before we have the real data to look at and make our own decisions. The problem with SEAS right now was some suggestion that there was an increase in cancer. Now, that's certainly a disturbing finding right now, but it turns out that what the Oxford group did was combine those results with two much larger trials that were as long or longer to see whether or not this was a real concern. What they found reasonably definitively that there was no increase in cancer using this compound, and that our concerns about this potential side effect were inappropriate. It's very difficult to really be able to contend with something reported in this way when there's no hypothesis as to why that would happen. You may remember that early on there was concern that pravastatin might cause breast cancer. When we finally did enough studies, that clearly wasn't the case. So right now, be very careful of jumping to conclusions before you have all the data to look at. The SEAS study will be presented soon, and we'll finally see whether this is a problem. Thank you very much. I'm Dr. Henry Black from the New York University School of Medicine and President of the American Society of Hypertension.